I just, okay. I just want to let you know what we're going to do today. We'll begin with J. Philippe Abraham from NICET, Secretary Treasurer. He will have an hour to do his presentation and to answer questions. And then we have another hour in which we're going to split between the three additional speakers. Each will have about 15 minutes to do their presentation. The first is Michael Bergen from Brooklyn College Speech, Language, and Hearing Center. He's going to talk to us about how you can make use of the services there for your hearing tests and whatnot. And then we'll have Michael Foley, Communications Director from the Welfare Fund. He'll give us an update and answer questions. You always have a lot of questions for him. And he is always very willing to answer questions after, the meeting. You contact him. He answers the phone and he's always willing to help you. And then Debbie Bell will be here she's now PSC consultant on the healthcare issues. You all know her because she was our executive director for the union for many years. She's going to give us whatever healthcare updates she can, given the lack of information that we get, and answer as many questions as she can. And then we have a couple of announcements about PSC actions up in Albany that we're going to be doing in the month of February. The Black labor leaders and fight for worker justice. Bonnie will tell you about that. And then Eileen Moran will talk about the Tax the Rich bus that we're going up to Albany in February. So, are we all set, Bonnie? You want to put that up or you?
I already did.
Yeah. Uh, so let me just introduce. Well, you want me to do the introduction first or stop the recording first? You want to stop the recording first?
Do the introduction first.
Introduction first. Okay. It was a very interesting and lengthy bio, which I'm not going to talk about the entire thing, but if you can, you probably can get it on the NICET website. But Philippe Abraham is presently the NICET Secretary Treasurer. He coordinates member benefits, accounting, and facility departments, and he's really the lead on their social justice efforts. He was elected to NICET's leadership in 2017. He was the first higher ed member and first person of African descent to serve as a statewide officer. Before NICET, he served 6 years statewide as the VP for professionals for UUP. In 2016, he was elected an at-large rep for higher ed on NEA's board of directors. In 2017, he was elected VP for AFT. He was twice elected to UUP's executive board and chairs quite a number of committees, among them the Legal Defense, Affirmative Action, and Latino Affairs. And he was the chief negotiator on their negotiating team. He's been working for 9 years as a NICET officer, focusing mainly on social justice work. Some of the many initiatives he's started there is the Many Threads, One Fabric program, the Social Justice Academy, and Pathways to Leadership program, and many others. It's a very rich bio if you guys want to go and take a look at it. Okay, so let me introduce Okay, we started the recording again. Michael Bergen will be here from Brooklyn College Speech, Language, and Hearing Center for the next segment. Where is Michael?
I'm here.
Okay,
Present.
Hey, fantastic. So if you would be so kind as to start your presentation. I don't know if
Of
you have
course.
anything that we want to put up, do you?
Yep, I do, and I have looks like I have sharing capability, so let me do that. Make sure everybody can see. If somebody could just give a thumbs up that you
Coming.
can hear me, and
Could you please introduce yourself? I think we
of
did not do a
course,
good
yep,
job of introducing you.
absolutely. So good afternoon, by the way, and happy Groundhog Day. I'm Michael Bergen. I'm from Brooklyn College's Speech Language Hearing Center. I know we have some limited time, I think 15 to 20 minutes or so I've prepared, and I thank you for taking time out today to join. I want to thank Bonnie and Ann, as well as the entire Retirees Chapter Board for inviting me. And a thank you to Mike Foley as well. So, Philippe was a tough, person to follow, and the topic is so important. I'm glad I was a fly on the wall, got to join for the last half an hour or so or listen. And what we do here in the Speech Language Hearing Center is not disconnected from from social justice, right? We do have huge healthcare inequity in New York City, in New York State. And I know that's not the topic today, but, I'll try to intersperse as we go along so we can keep it topical. Some of the things we do here as parts of our curriculum in our doctoral and graduate programs that are related to that as well. So briefly tell you a little bit about myself and then a bit about the Speech Language Hearing Center at Brooklyn College. I'm an audiologist. I have the title of director of the Speech Language Hearing Center, and I've been with Brooklyn College since the early 90s in various roles. So my current title for over 20 years. I'm CUNY through and through with an undergraduate degree from Queens College, a master's from here in Brooklyn College, and a doctoral degree from the Grad Center. I wear a few different hats here. I'm in a HEO position, so I'm a PSC CUNY member. I'm not yet a retiree, but someday I hope to be logging in and participating on the other side of this. And, I'm mostly engaged in administrative tasks these days, but I also do teach doctoral courses and master's courses. I'm involved in some funded projects, and I do fortunately still see some patients, although perhaps not as many as I would like because of time constraints of my quote unquote day job. So the Speech Language Hearing Center was founded before our current campus even opened. If my math is right, we're going to turn 94 years old this year. And we have roots dating to the earliest days of speech language pathology and audiology. And with many prominent researchers and clinicians, who've come through our programs, the Speech Language Hearing Center serves the greater community, not only students and faculty. And it's also the site where our graduate and doctoral students obtain experiential learning skills under the supervision of New York State licensed SLPs and audiologists. We work closely with several academic programs in our department. The one most relevant to this talk is Brooklyn College's doctoral program in audiology. Yep, Brooklyn College has a doctoral program. It had been, the degree had been conferred by the Graduate Center, but it moved over here to Brooklyn, which is great. And to our understanding, the first doctoral program, that will be the first doctoral degree to be conferred by Brooklyn College. We have a large faculty of audiologists on campus, and currently 3 of those individuals, Doctors Drillick, Reisman, and Strom, regularly see patients and dispense hearing aids here. All 3 are longtime employees who are also PSC CUNY members. I realize that many in the audience today may have spent, time on our campus in the past, whether working, studying, or visiting. If you have not, I would suggest just capturing that QR code there. It links to a short YouTube video, which has flyover video of the campus, which is, it's a beautiful campus, snow covered right now. On the last slide, of this presentation, there's a QR code to this presentation. So if you don't have time to find these things, you can download the presentation later. And if you miss that, you'll have my contact info. You could always reach out to me, or I'm sure through the board, you can access me. Real briefly, just some disclosures. I'm a salaried employee here, as you guessed. I've also received funding from the Department of Health, New York City's Department of Health, for some work related to workforce development. A lot of that certainly has to do with, healthcare equity in communities. We're talking about little ones 0 to 3 aged for early intervention. Non-financial disclosures. I'm on, some different committees and leadership at the national level with ASHA, that's the American Speech Language Hearing Association, with NISHLA, that's New York State's Speech Language Hearing Association, on their Governmental Affairs Committee. And I'm a member here proudly of Brooklyn College's Alumni Association's Board of Directors. And it's great to just meet folks who've been, coming to campus here for eons, it seems. Real, quick agenda. We've got 3 main points that, Bonnie and Ann in our interactions, we talked about covering. One has to do, I realize perhaps many in the audience have been through this process before, so, forgive the redundancy if you're familiar with some of this, but I'm really, a lot of what we're going to talk about is targeted to those who may never have, been through hearing aid dispensing process or even a hearing test. So we'll, outline what those steps are, whether that's something you might feel you or some loved one, friend, acquaintance is ready for sooner or later. You'll have contact info to always follow up afterwards if needed. So we'll cover the hearing aid dispensing and related steps. We'll talk about PSC CUNY's hearing aid benefit options. There are a couple. One is True Hearing, and the other is also an option to go to a non-participating provider. So we'll talk a little bit about those choices. And then, lastly, we'll end on what those services look like here in the Diana Raghavan Davidow. She's an alumna donor, Brooklyn College Speech Language Hearing Center. Okay. And we are a provider for True Hearing here at Brooklyn College. So we'll talk about that. And then if there's time, I'll leave that to Bonnie and others. If there's time, I'm open to questions. If not, you can always shoot them to me via email and or through the board. So the typical steps, and there's not like a one, step fits all kind of process. There shouldn't be for any healthcare follow-up, that you have. But the more typical, course of action that one would take that goes, that the progression where you might go for a hearing test and wind up with a hearing aid would look like these, bulleted points on the screen, this sequence. The first step would be a comprehensive audiological evaluation. I realize sometimes people think they've had that. Sometimes, folks have had a hearing screening, perhaps in a mobile unit or at a health fair. That's not a comprehensive test. They're great and important, and they help steer people towards, getting proper health care. But they are, too limited to rely on for the purposes of fitting amplification hearing aids. So the first step would be, once an individual identifies having some hearing difficulty, to go for a hearing test. And there are a number of ways you can do that. Through your PSC CUNY benefit, hearing tests are included. And we'll talk about what that process is. For those who have, hearing loss that's identified and they're interested in pursuing amplification, the next step would typically be a referral to to a physician or an ear specialist, like an otologist, for some medical intervention if needed, particularly if there's any red flag conditions, meaning if somebody has pain in their ear or a draining ear, if they have blood, or any of the things that you might assume would require medical intervention, then that follow-up is required so that the person can, be treated if needed and then be medically cleared to wear hearing aids. The next step would then be to head to an audiologist or dispenser, hearing aid dispenser. In New York State, as in many states, there are different professionals who can dispense hearing aids. I'm an audiologist. An audiology entry-level credential is a doctoral degree, but it's not only audiologists who can dispense hearing aids. There are non-audiologist hearing aid dispensers, some of whom are great. That it doesn't mean there are long practicing hearing aid dispensers as well who are not audiologists. But just so you have some sense, as a consumer, you should be educated about what those differences are beyond the scope of today. But certainly, if you had more questions about that, you could reach out. The place where you go for this third step, the hearing aid consultation, may be the place you went for the comprehensive evaluation, but it may not be, right? You may have wound up having that complete audiological in a place that does not dispense hearing aids, so you'd rely on some referral. And we'll talk again about what the steps are through, through True Hearing coming up. But this hearing aid consultation and evaluation involves a selection process. You would discuss with the hearing aid dispenser or the audiologist. There'd be educational counseling involved, where they describe different options you have, one ear versus two ears, for example, different levels of technology, different manufacturers, different sizes. There's a lot that goes into that, I literally, if we carved out at 90 minutes, we'd probably, be able to cover here. But they're very individualized. It would be pointless to get too deeply into that here anyway. Assuming at the end of this hearing aid consultation visit, the patient, were interested in hearing aids still and had come to some decision about that, then the next step would be for the audiologist to order the hearing aid and fill in some sort of contract that details what payments are. By New York state law, there are some guidelines on what exactly should be in those contracts. There's also a trial period in New York State of 45 days. So there's pretty, solid consumer protection, all of which is very clearly outlined, in the New York State Department of Health's website. And again, if you have any questions, you could always reach out for that. So that next visit involves the dispensing. Typically, that would take place a couple of weeks after the hearing aid is ordered because in some cases it could happen quicker than that, but particularly for products that are custom fit to the person's ear, they take some time for the manufacturer to craft. Brooklyn College doesn't make hearing aids. Most audiologists would not make them, but they, partner with different manufacturers, probably some brands you've heard of before, and we have that coming up on a subsequent slide. The manufacturer, makes the hearing aid and sends that to us, and we're responsible to verify that it's functioning properly, check it in, program it properly, do all of those things behind the scenes before the patient returns so that there are no surprises on the day of the dispensing. And at the day of the dispensing, we can really focus on a little bit of testing and, primarily showing, working with the patient, working with the patient's family members who they may have wanted to bring along, how the hearing aid is used, how to put it in and out of an ear, maintaining it, cleaning it, charging it if it doesn't use batteries, changing batteries if it does use batteries. There are different, characteristics to each hearing aid that are unique that, would dictate how that visit would work. If at the end of the hearing aid dispensing, the patient, can work pretty independently with that, they would go home with it that day. And that's when the trial period kicks in. And then that typically leads to the next appointment, which may be the final appointment of the series, but may not be. So there would typically be at least one hearing aid follow-up visit. And that usually takes place, in the order of 2 to 3 weeks after dispensing. That can vary by the patient's needs. We typically like to get patients in a little bit sooner if they're having some difficulty or if we anticipate that might be more likely, as we might see for a less experienced user. And then, going a little bit longer towards the 3-week end might be, make more sense for somebody who's more experienced. At that follow-up, it might be a very quick visit. Maybe something where we're just inspecting the ear and making sure there's nothing irritating, do a quick check of the hearing aid and make sure it's not plugged with wax and some of the things that might happen to hearing aids. Run it through our technology here to make sure it's doing what it's supposed to do after a couple of weeks of usage, and leave and provide an opportunity for the patient to have anything, any issues addressed. There's a lot of, the amount of time needed for each step can vary a lot, because of the individualized needs of the patient. So, for example, the experienced patient might have more educated, contributions to the process of ordering something. They may have worn a particular style before and know that that's exactly what they want. And that doesn't mean we're not going to spend time outlining the options, but that may lead to a speedier sort of decision-making process. Although there are, some like things like low vision or tremors, they're not contraindications to using hearing aids, but it can certainly make the processes associated with orienting hearing aids, the hearing aid orientation process, take a little bit longer, perhaps require additional visits, et cetera, et cetera. So I know time is dwindling, and I do want to talk about, the retirees benefit through PSC CUNY. And so there is a QR code here if you're quick at snapping it again. If not, you can download the whole presentation. It'll be in there, but it links to the PSC CUNY Welfare Fund's site that outlines some details about that. The benefits are available to retirees and your covered dependents every 3 years, right? So that means you're eligible for hearing aid now if you go through that process, or hearing aids for 2 years. If you go through that process and order them, then, assuming the benefit doesn't change, 3 years from that dispensing date, you would be eligible again. There is an option to obtain services through True Hearing. We'll talk about that, or via non-participating provider. And that's the information. To initiate the process through True Hearing, there are a couple of ways you can jump in. One is by calling them directly. That's the way that they recommend. And they'll provide the names of 3 participating providers. You can request additional names if those for any reason don't work for you, and or you can specify a provider. So if you had a trusted dispenser audiologist who you knew was part of the True Hearing network, you could request that. And if that, the same would go for us. You could request coming to Brooklyn College. If you choose to not go through the True Hearing process, and there's strong reason to go through True Hearing, but if you chose not to, you'd also have to call that number because there is some sort of authorization that they do need to indicate so that you can get the benefit still. Okay. This is a flyer that is a typical flyer that is sent by email to the individual who contacts True Hearing. And once they've verified eligibility, I know the print is really tiny. Again, when you see the presentation, if you download it, you'll be able to expand that. And it has a lot of detail there, but you don't have to worry about the nitty-gritty of it today. But the things I did want to highlight are that there's a list of the providers who I've known to be eligible dispensers rather, the manufacturers rather, that produce products that you can obtain through True Hearing. So these are, pretty well-known manufacturers, the, ones that we at Brooklyn College are familiar with and work with. Signia, Widex, Oticon, Phonak, Resound, and Starkey are the big ones. True Hearing has their own labeled hearing aids as well. My understanding is that those are generally Signia products. So they don't, they clearly don't make their own hearing aids, but they're made by an established manufacturer. And then, although I realize it's tiny there, I did want to highlight that through True Hearing, you're eligible for different levels of hearing aid technology, with the highest level of technology typically called premium technology. Below that, you'll see advanced, below that standard, basic, and then some entry-level products. But the point I want to make is that for premium, through True Hearing, the person who's the beneficiary pays $1,799 per hearing aid, but they're eligible to have a $1,500 per hearing aid allowance applied to that. So the most expensive hearing aids through True Hearing that I'm aware of that you as a member would pay for would be $1,799 minus $1,500. So that would be $299 per ear. I've dispensed a few myself to PSC CUNY members, and we ordered in both cases. The last 2 cases, premium technology, the individuals paid $598 total and wound up, having premium technology. If they had opted for advanced or some lower technology, which doesn't necessarily mean bad, that's a conversation for another day, there would be no out of pocket based on that, if assuming that was all that was being dispensed. And then lastly, I did have this slide. Do we still have a couple more minutes, Bonnie? We're still good. Last slide here just asks a couple questions. And we do realize at Brooklyn College that, as a PSC CUNY retiree member, you have options, right? I'm biased, and I feel confident that if you come to Brooklyn College, you'll experience superior comprehensive service with our patient and caring audiologist. You'll have access to the full PSC CUNY benefit, which you earned and paid into, which I also pay into, by the way. And you will have options from an extensive array of products. However, there are times you may be better served elsewhere, which might sound like a strange thing coming from somebody who's trying to tell you all the great things about their program. So when might that be? I realize there are 150 plus people here, and you don't all live, a short trip to Brooklyn College. So for example, if you don't live close to campus, that doesn't mean you shouldn't come to Brooklyn College. I do have very long-time patients who travel from Westchester and from Suffolk County and from New Jersey. I have some patients who are snowbirds and spend time down in Florida and still maintain residences here. And it might be more geographically convenient to be elsewhere, but they've stuck here. But particularly if you're a new user, if you don't live close to campus and or if there are mobility limitations or health considerations, there's something to be said for the convenience of finding a reputable professional who's nearer to you. There's an argument for continuing with the existing audiologists you may have already forged a relationship with, right? Our goal isn't to like take patients from everywhere and, run you through a Brooklyn College system. Our goal is to help, people to hear better here. So, experiences across providers will vary by the expertise of those at the location. Strongly consider recommendations you may have from trusted, folks. In short, each person's individual and family needs should dictate those decisions. But if ever you have questions, you can certainly reach out for guidance as a resource, us as a resource, because we're a part of the CUNY family here. So to make an appointment with us, there's info about our website. And then on my last slide, there is that link I, promised to this presentation. So if you want to snap that, you can download the presentation and run through it again. Just the PowerPoint. I mean, it's not a video. And or feel comfortable to reach out, phone, email, whatever works best for you if ever you have questions. And I do see Bonnie's hand up, so I'll start with Bonnie.
Yes, I just wanted to thank Michael for coming. I wanted to say that I have been to Brooklyn College Speech and Hearing Center for my first pair of hearing aids, and then not very convenient to me. And then when CUNY started, when the PSC started having this really great hearing aid benefit, I started going to audiologists that were closer. But I liked going to Brooklyn College best. The people were nice, really nice, that got a lot of time there. And I, particularly as an educator, I liked the idea that I was helping to train the next, group of audiologists. I liked the students there, that they were learning. It added something to the experience. I had one specific question though. With my true hearing benefit now, I get I get fitted for a hearing aid, and then they told me that I have 2 or 3 additional visits I can do in the first year, and after that, if I want to see the audiologist again beyond that first year, I would have to pay. When I was going to Brooklyn College, they encouraged me to come back for annual checkups, and I was wondering if those are included, if Brooklyn College still does that, or is there a cost to that?
So we haven't changed any of our, thanks Bonnie for that. And also I thank you to those folks in the chat. I see a bunch of familiar names and faces, around, and it's good to see you there, praising services of Brooklyn. That's great to hear. To Bonnie's question, we do encourage people to pop in, and obviously not just walk in, usually call and make an appointment when they're having any difficulty at all. There are, through the True Hearing program, there are unlimited, it does say unlimited, which sounds a little daunting and scary. And I would imagine most people won't show up 365 days a year. That has never been the case, knock wood. But unlimited visits at no cost. There is a provision, to my understanding in the contract with True Hearing, that a True Hearing provider can charge up to $35 for a short visit, which I think they define as being 30 minutes or less, and up to $65 for a longer visit, which would typically be up to an hour, beyond a year. It's not been our experience at Brooklyn College to do that, to charge. If the patient requires a new hearing test, then there are typically fees associated with a test. If there are charges related to a hearing aid being out of warranty, then, that the manufacturer charges Brooklyn College, then we have to, pass those charges along. As a True Hearing member, the contract stipulates that there's a 3-year warranty on the hearing aids, so there shouldn't be charges associated with that. So in short, Bonnie, although I can't predict, what will be forever, policy of Brooklyn College into the future, it's not been our history to charge for those visits when the visits have been a hearing aid that's in warranty and they require some simple cleaning or something like that. And I wouldn't anticipate we'll change that anytime soon. Okay. And there were also a couple quick questions about parking, so I just wanted to address that quickly in the chat. there's no, sometimes there's street parking that you can find and, that kind of thing. When folks have mobility limitations, it can be a bit of a schlep from some of the places they may have to park. So if you know that in advance, you can, arrange with our staff and we can contact public safety and try to arrange for parking. Most of the time that can be done. It involves taking, your license plate information and car info. It's hard to do on 24 hours notice, but when we have an appointment set a week, in advance, not a big issue. You can always request it and we'll do our best to try to arrange that.
Okay, thanks. Well, I'm going to ask the people who have individualized questions to contact, the PowerPoint presentation is up in the chat and to contact Michael. And thank you, Michael, very much for the very helpful presentation. We all, many of us have had tests and need your services. So we'll move to the next. We have to unfortunately move along. We have two more speakers. And the next person is Michael. I think I saw Michael Foley from the Welfare Fund on here somewhere.
I'm here. I'm here, Diane.
Okay, Michael, I'm going to ask you to try to, stay within like 15 minutes.
I frankly, I just want to say thank you to Michael Bergen for a wonderful presentation. We are so thrilled to have the audiology clinic at Brooklyn College as part of as an official true hearing provider. He did a lot of hard work to make this happen. So, congratulations to him and congratulations to all the skilled people at Brooklyn College. It's a fantastic place. So yeah, all of you get on the 5 train, go to Flatbush, get your hearing aids.
Yes.
So in any case, yeah, Diane, I'll keep it short. Why don't we just do Q&A, okay? I mean, there's not a ton going on with retirees right now. We are swamped with calls at the Welfare Fund right now about the change for active employees to this new medical benefit. You may have been hearing about it. This is what you all went through 2 years ago when the city tried to move you into that Medicare Advantage plan. Everyone is concerned. Unions did a great job with fighting that. That was defeated. This was not defeated. So this is happening right now. There's a lot of confusion. In case anyone has any questions about that, I'm happy to answer them. But it does not impact retirees in any way. Your Medicare.
It doesn't impact retirees who are on Medicare.
Right. Under age 65. Thank you. Thank you. Thank you. Keeping me honest there. I appreciate that. If you are under age 65, yes, this does impact you. So yeah, it's serious for you. So I hope it's going all right for you. Again, let's talk medication just briefly for all those of you. Bonnie,
Mike, could you just answer a question in the chat about the hearing aid?
Yeah, of course. What was the question?
The question was, does the benefit apply to just the member, or can
dependents as well,
and spouses?
Yep. Dependents as well. If you have officially listed dependents, they're good to go. And keep in mind, by the way, as Michael pointed out, you can always go to some other provider who's not in the True Hearing Network, but if you want to get the $500 reimbursement, it has to be a prescription over-the-counter hearing aid. And those are kind of rare in a way. You can't just walk into Costco and get a over-the-counter hearing aid and expect the $500 reimbursement. So just keep that in mind. But anyhow, back to under 65 retirees. Debbie, what are you hearing? Bonnie, what are you hearing? How are people handling this? The under 65 folks.
There is one question from Gloria Paulus.
Oh, hey, Gloria, how are you?
And then I'll do a quick presentation on the plan, Diane. That might make sense.
Yes.
Yeah.
And stimulate some questions.
Gloria.
Yeah, first, I hear an echo. Okay. I'm pleased to inform you that I was enrolled in Medicare, but it starts in June. I'm getting close. But what I noticed about the portal is that if I want physical therapy, it's not.
Okay, I just muted Gloria because there was a really problematic echo. So maybe Jessica can help with that process, and then we'll ask anyone else if they have a quick question for Michael before Debbie gives her presentation about the welfare fund stuff. Okay, she has her hand up again. Let's see if we can get her to ask her question.
I think Walter has a question.
Okay, Walter, go ahead. He has to be unmuted.
Yeah, okay. I have an appointment at Mount Sinai Hospital coming this week, and I got a notice from them saying we are currently out of network with Anthem Empire Blue Cross Blue Shield. Your appointment may proceed using out-of-network benefits or self-pay. Please be prepared to pay at the time of your visit. What's that about?
Let me tackle that.
Thank you, Debbie. Thank you. I've been trying
Uh,
to tackle that. Yeah.
are you on senior care? Are you Medicare eligible? Are you
Yes,
active?
yeah, sure.
Okay. So you're a Medicare eligible. Are you on senior care?
I believe so, yes. Yeah.
Okay. On senior care, Anthem is the hospitalization. So if yours is an outpatient appointment, it should be under Emblem Senior
Yes.
Care. The problem is that so many of these doctors are hospital affiliated now that they charge through the hospital, and Anthem Blue Cross is fighting with Mount Sinai about a contract. So I would contact Senior Care. I would go on the Emblem website, find out how to contact Senior Care, call somebody and say, I want to see Dr. X at Mount Sinai on an outpatient basis, but Mount Sinai is telling me I'm going to have to pay in advance because of their fight with Emblem. See what they say. This is going to have to get resolved. It's been going on for a number of months. It's going to get resolved, but it may take some time. So that's the explanation for it.
But a follow-up question. My wife had an appointment at Mount Sinai last week and did not face this question.
I understand. That's why I say, technically, if it's an outpatient appointment with a provider, Anthem should
It
not
is.
be involved. The problem is that some of these providers bill through the hospital because the hospital has gobbled up all the doctors in New York. All the hospitals have gobbled up doctors. That may be the problem. You could try your doctor's office again and saying, I'm not coming in for a hospital. What is it? Just a visit, or is it a treatment of some kind? If you pardon
It's just it's a checkup.
it's a checkup. So
Yeah.
I'd call the doctor's office again and say, this should be billed through Emblem, not through Anthem. See what they say. Then try.
Actually, it should be billed through Medicare.
Yes, it should be billed
So
through Medicare.
so it shouldn't matter. It sounds like the hospital doesn't realize that your primary insurance is Medicare.
Okay, I'm going to,
That's very possible. That's happened often before.
Okay, so
Yeah.
push them on that. Thank you, Bonnie.
Yeah.
I'm going to
Thanks.
call Gloria again. She said she has her audio fixed. Go ahead, Gloria.
Hi, okay, can you hear me now? Better? Okay, I'll just write in the chat.
Okay, Deborah Mazia. Deborah here? Go ahead.
I'm a cancer survivor on maintenance Keytruda treatments, and I've been going to NYU. And this past week, I got a estimate bill for $7,800 for the treatments because of the new plan. Now, my question is, NYU is on the list of downstate hospitals that are participating. What is the difference for an outpatient treatment of a preferred provider or an in-network provider? Because on the chart, under preferred, it says no charge, and participating has 20%.
Deborah, I don't want to get too deep into your specific situation, but I believe that type of medication would be, are you over 65 or under 65? Forgive me for asking.
Under.
Okay. So did you get your nice PPO card in the mail?
Yes.
Did you try and use that card to fill that prescription for that medication?
It's not a prescription, it's an IV treatment.
An IV treatment.
I get it every 3 weeks.
Okay. Deborah, I'm going to put my email in the chat. Can you get in touch with me specifically, and I'll have and we'll correspond about your specific instant situation?
Okay.
Okay.
All right.
I contacted the hospital and they're investigating that. I was just wondering, what the rules were.
Okay. Yeah, I don't want to get too deep into like your specific
Okay.
situation. It's kind of the wrong forum for it. So let's you and I talk privately.
Yeah.
Okay.
All right.
Sounds
Thank you.
good. Thank you.
Okay, before we go any further, Debbie, do you want to give that presentation you were promising us?
Sure, and I'll make it quick.
Yeah.
NICE PPO is the new health plan effective January 1 for active employees of any age and for retirees who are under 65. It stands for New York City Employees PPO Plan. It replaces the GHI Anthem plan that people had previously. In general, New York City is telling the unions that the transition from the old plan to the new plan has been remarkably smooth. In other words, people haven't been dropped. If you try to get service and there's no record of you having coverage under NICE PPO, please contact, or a dependent runs into that, Jess Baker at the PSC, and she will contact Emblem and they will fix it. They've been fixing those problems quickly. The most significant positive change for retirees under 65 is that the in-network provider network nationally is much bigger. So people in Arizona and Florida and all over the country have many more in-network providers that they have access to in this plan. That's the major positive. It's very similar to the old plan. The union's political concern has been that if the city doesn't save enough money under the new plan, which it's hard to believe they will, but they claim they will, they may start narrowing some of the benefits. So we want to keep a close eye on what's going on, and we will. The many of the providers in the old plan, in fact, they claim most, are in the new plan, and they worked quite hard to try to expand the number of providers. For people who live in the downstate New York 13 counties, Emblem is the main provider. Everybody else is in the United Health Network. The United Health Network does not apply inside the downstate New York 13 counties. The one area where there is change is in the behavioral health area. There has been, again, a lot of effort to ensure that the transition from one behavioral health provider network to the new one goes as smoothly as possible. If you have problems, you should be contacting go on the NICE NYCE PPO website and link onto the customer service part of the site, or call the customer service number for assistance. We can't help you directly on those kinds of problems. The other big problem has been in the area of drugs. Most active and retired PSC members get their drugs, all of them get most of their drugs through the welfare fund. There are, however, for active employees, a few drugs that they receive through the health plan. And the new health plan is using a new drug provider for things like insulin and reproductive drugs and AIDS drugs, the drugs that health plans are required to provide under under Obamacare, basically. And there have been some transition problems there. I think that's what Mike was alluding to about, among other things, about all the calls they are getting, where my advice would be to call the welfare fund first. They will do their best, at least to guide you where to take your question and your problem. But the main thing to remember is most of your drugs you still get through the welfare fund, and all retirees still get their drugs through the welfare fund. One other note is that the union has started to collect stories If you have a problem with the new health plan, the union wants to know about it and what you have done to resolve the problem and how well it was solved. We're doing this because we want to be, among other things, as I said earlier, we want to be prepared for any potential changes that the city might seek to make in the coming years in the health plan, so that we know where there are flaws in its current structure, and we can try to defend against further erosion in the benefits. That's the main thing I wanted to say, to try to provide a context, Diane.
Okay, so what I'm thinking is we have about 15 minutes left and we'll take a couple of questions, but I would ask the questioner that if it's it's a question about your individual case, that you speak to or contact Mike Foley directly, and he has been happy to put it in the chat, and to contact Debbie directly. That if you ask a question, it'll be no?
No, individual questions should go to Mike. I think
That's fine.
other questions
Yep.
should come to the chapter, and the chapter can contact me.
That's
Okay.
fine. Yep.
And
That's
I
fine.
also, Diane, I will also do 5 minutes on the stabilization fund.
Okay,
before we
why don't
close.
you do that first and then we'll close with the questions. Do you want to?
Okay. For those of you who saw the news late December, early January, bombshell audit of health insurance stabilization fund. And I was asked by the retiree chapter to explain what that was about. It's not such a bombshell, in fact. The reason it was a bombshell to the New York City Scoop and other reporters is that very, very, very few people understood the health insurance stabilization fund that exists in New York City. It is a fund that was established 40 years ago. And the original goal of the fund was to provide a place where the two premium-free plans, where money could be deposited to ensure that the premiums for the two premium-free plans, in other words, GHI and HIP HMO, where employees don't pay a premium, to ensure that those premiums could be paid. I'm doing a very mile-high overview. I'm one of the few people who actually understands all this, but I'm not going to bore you with it. 40 years ago, what happened was this fund began to accrue a fair amount of money because the two plans didn't get too far out of balance. That's a simple explanation. It's probably too simple, but therefore, in about 2001, when drug prices were escalating rapidly, the unions in the city negotiated an agreement whereby some of that accrued money could be used to pay for pica drugs. If you remember, as an active employee, certain kinds of drugs were taken out of the welfare fund's purview and were paid for with a pica card. Over time, it's only now injectables and chemotherapy, and that's only for active employees. It's not for retirees. As the money grew, a few other benefits were subsidized with the money, and then starting about 10 years ago, the premiums for the two plans got out of balance, and the money in the health insurance stabilization fund started to drain away, and now it is basically zero, except for funds that are locked into place to pay for the run out of GHI and Anthem. In other words, there are claims which, as of December 31st, had not been paid by the city of New York. This fund will now pay all the claims that come in for the next months and basically pay down the remaining money. The payments for PICA are not separate anymore. They are incorporated into the new health plan for active employees. The health insurance stabilization fund, as soon as that run out is paid out, will disappear. There'll be an agreement between the unions and the cities. It's out. There's no need for it anymore. HIP and GHI premiums aren't an issue anymore. It will go away. Now, why was this a bombshell from the point of view of or why was it important or an issue from the point of view of the controller? One, it was an off-budget fund. This was a Giuliani maneuver back in the 90s to get this obligation of unpaid claims off the city's budgetary rolls. In other words, unpaid claims any year can be in the tens of millions of dollars. They get paid eventually, but because hospital bills, they take forever to come in. He wanted it off the city budget so it didn't show up as a liability in the city budget. So it was parked in this off-budget stabilization fund. The stabilization fund was off budget because it was an agreement between the unions and the city to park money to help pay for premiums, but its role expanded. This was arguably part of the reason that the accrued monies were used to pay for other benefits, and some monies helped subsidize some of the welfare funds at certain points in time. It's not a pretty picture, however you look at it. I'm not going to make apologies for how it was managed and handled. But the controller's main complaint was the fund did not comply with existing laws. I'm not a lawyer at all, but enough of a lawyer to understand whether he's right or not. There are a number of union lawyers who say he's wrong, but that it didn't comply with existing laws and that it was off budget and therefore away from accountability the way all the normal budget elements of a city budget are. I think it's because it's just going to go away once all these claims are paid out. It's not going to be a lingering issue. And the underlying question, which this group has tangled with for a while, which is why does the MLC agree to all these things that aren't quite kosher? The PSC leadership understands and it was the PSC, quite frankly, 3.5 years ago, who told the controller to do this audit. We were in a meeting, we said, you ought to audit this fund. Remember, Medicare Advantage was supposed to save money that would go into this fund to keep this fund alive. We said, wait a minute, it shouldn't go there. You should audit what this fund is up to. That's old history. The fund's going to go away. But I would argue that the relationship between the MLC and the city in terms of devising things that are not transparent is an ongoing issue. So I'll stop there.
Okay, we have 4 people on a list with raised hands, and we're going to go in order. Again, I'm asking people to ask questions that are relevant to the majority of people here. If you have individual questions, Mike will be happy to address them for you. Bonnie is going to take over in a minute to chair because I'm going to run to another meeting. So let's start. We had Estella Arriaga, then we have Francis Tomei, then we have Mike Frank, then we have Cecilia McCall. So Estella, why don't you begin? Hold on, you have to unmute. Hold on. You have to unmute.
Yes.
There you
Great.
go.
Hi, Diane. I don't know if you remember me. We worked on the same floor at Queens College.
Oh, yes. Hi.
I miss you and your sugar cookies. She makes the best sugar cookies. If you haven't tried them, you are missing the best cookies ever.
Butter cookies, by the way.
Butter cookies.
Oh, butter cookies. I thought they were called sugar cookies. Okay, so my question is a general question. I went to the doctor today and I was asked to pay for to give the copayment. But if I remember correctly, last year, we didn't have to start paying the copayments to the doctor until we met the deductible for Medicare and GHI senior care. Has that changed? Am I wrong? Somebody?
No, you're not wrong. You're not wrong. You are correct. So if this is the first time you've gone to the doctor since January 1, you will, when your bill, you should not pay a copay. You should tell them bill Medicare. Then what you'll see is, the copayment for Medicare, which is $200 and something this year. It's not nothing.
83, I think. Yes.
Yeah. And there's also a $50 copay for
GHI.
Emblem.
Yes.
Right. So those two pieces you're going to have to pay. And it is unlikely that will result in you're having to pay a co-payment for this visit. If the
Okay.
visit is expensive and you pay that money, then the next time you go to the doctor, you will have to pay.
Oh, okay, perfect. And then another quick question. Another quick question is a friend of mine kind of frightened me. She says, with the new mayor, he acquired a major deficit. Are we in danger again of having Medicare being taken away from us and replacing it with Medicare Advantage?
I would say absolutely not. Medicare Advantage, the whole program, the whole national program of Medicare Advantage has changed dramatically. There is no way a plan could offer the city of New York the kind of savings that Aetna offered 3-4 years ago. So Mamdani said in his campaign he wasn't going to go for Medicare Advantage, but fiscally it doesn't make sense for the city anymore either. So I don't think we have to worry about it. We have to worry more about what Trump might do to Medicare nationally.
Oh God, yes. Okay, thank you.
Francis, how about you? Can you unmute? Francis Tomei, you have your hand up? No, you're not interested in a question? Okay, we'll move to Mike Frank. Mike Frank, you have to unmute.
Hi, Debbie. Debbie, I have two questions, and it comes from reading the article in the Clarion, which I thought was a pretty good article called Understanding the New City Health Plan. It's rather comprehensive. It lists the weaknesses, the loopholes, et cetera, the things to be careful, aware of, et cetera. So the first question, the article begins by saying, the MLC agreed to a new health plan that includes an expansion of existing coverage, an expansion of coverage without increasing costs for employees, and while simultaneously providing savings up to $1 billion annually. Now, my question is, how is that possible? Okay, to both increase the coverage, not increase the costs, and somehow save $1 billion. It sounds like a description of a magic trick,
Right. I think it is. I think there's a bit of a magic trick. I think the increased coverage is primarily the improvement of improved access to in-network doctors for the pre-65 retirees. There's not huge amounts of increased coverage. Yes, that's an absolutely legitimate question. How are they going to save money? I believe they claim, and there's some truth to this, that because outpatient and inpatient records and billing will be integrated, there will be less duplication of costs. There will be more efficiency and that will have a savings effect. I can't believe that's $1 billion worth of savings. So we don't believe it. We've challenged both the MLC and the city of New York. They say, I think the MLC is somewhat skeptical, but the city says they think they'll save the money. So maybe they will, maybe they won't. We'll see. I don't have an answer, Mike, because I share your question.
Okay.
And then Jim?
No, I have another second question, if I may.
Go ahead.
Diane, okay. Sorry for squeezing two questions in. The second one, I thought I heard Barbara Caress say that there were 30 pages of redacted parts of the contract.
Between the city and United.
Yeah, yes, 30 pages of redacted material. Now that's a lot. And the Clarion article says PSC has not been informed of the financial details of the contract. If such, the financial details of a contract are the heart of a contract, it seems to me. Okay, so my question then, you probably can't answer it, is why we would agree to such a thing in the first place? Why we would agree to consider even or pass on, a contract whose guts are not there. Right? So that's my second question.
Well, first of all, President Davis of the PSC did not vote to support the contract. So we, in the collective PSC, we didn't agree to it for that very reason. We didn't understand the financing. Why the rest of the MLC would vote for it? I mean, there were some locals who voted against it, but the two big locals, DC 37 and UFT, voted for it. Why they did, I can't explain. They knew that these pages were redacted. The comptroller's office tells us that when they reviewed the contract, they didn't see most of this information. So, you know, it's not a pretty picture, and particularly the fact that it's with United Healthcare is very distressing. There's no answer to your question.
Okay, thanks.
Thank you.
Diane, if you want, I'll take over now. I know you have another meeting.
Yeah, okay, so you're going to start to chair for us, right? And I'll see you all.
Okay. Cecilia, I think you have a...
Yes. Well, I hate to say this after this conversation, but I was watching New York One News a couple of days ago. It was after Mamdani announced that there was a $12 billion shortfall in the budget because of Adams. The reporter was talking to Julie Menin, the new Speaker of the Council, and he was asking her where they were going to find savings. Did she have any ideas? And she said, yes, I have an idea. New York City Public Employees Healthcare.
Okay, I didn't hear that, but I'm not surprised. New York City Public Employees Healthcare is at least 10% of the city budget. It's a lot. Now, in Julie Menin's defense, Julie Menin understands that an approach whereby you go to all these hospitals in New York City that charge an enormous amount of money for healthcare services and say, hey, you guys get tax relief. You want to keep your tax relief. You've got to make contracts with the city employee health plan that are a lot better than the ones that exist now. That's one approach that PSC has proposed. I don't know how aggressively I don't think the Adams administration did anything with it, but I think that I hope the Mamdani administration has a better understanding of some of the strategies, the political strategies outside cutting New York City employees' benefits that could be pursued to save money on employee health care. That's not an answer to your question. I mean, I think it's a genuine concern, but I do think that the work that was done around Medicare Advantage in the city council means that there are a lot of well-educated council persons who understand how important healthcare is to both active and retired city employees. And I think they will be, if necessary, we can remount lobbying campaigns, and I think they will be responsive. I think the challenge is there really are ways to cut the costs, but the Adams administration didn't pursue them. The question to me is whether the Mamdani administration will. And, they haven't been that engaged so far, so we'll see.
Thanks, Debbie.
Jim?
Yeah. One of the things that we've become distressingly clear about is the total inadequacy of the city's management of healthcare and its abject lack of monitoring of costs and expenditures and stuff like that. And so it makes a lot of sense for the PSC to be recommending our members to contact the union, contact the welfare fund with their experience under this new health plan. But as a practical matter, if to make that really effective, wouldn't it be desirable for James to send a direct message requesting that information on experience to every member, not just put a notice in the website or something like that, or have you announce it at a retiree meeting, but actually directly contact each member?
Yes, but I'm not in charge of that anymore. Yes, I think the honest answer is that there's a lot going on at the PSC, and the outreach, the semester has only just begun. The outreach, I believe, has only just begun. I think the leadership was going to start with the chapter chairs. But I will pass on that suggestion that a direct request to every member might solicit many more responses than a general one.
Thank you very much for these questions and comments, and thank you, Debbie and Mike. I put a couple of things in the chat. There is on Wednesday, there is a session at this is in the way of announcements, at the Union Hall, at the PSC, in person, called Black Leaders and the Fight for Worker Justice. And that I put and that's 6 to 8 p.m. this Wednesday evening. And I put the link to sign up in the chat. And I think Eileen Moran was going to talk about another announcement that we want to make.
Right. I want to engage all of us in the PSCs, as well as it's a very broad coalition to tax the rich. This is both the folks who are advocating for enhanced childcare credits, for health care, for social services, etc., including obviously CUNY. What the PSC's message to everyone already said was that we have, since 2022, 21,000 more students, but not more money. Now, we know the only way to adequately, service those students is to actually have a bigger budget. So we really need to push hard so that CUNY can get that additional revenue. But it implies that part of that will be to tax the rich. So if you can, on February 25th, there's going to be 2 buses leaving Manhattan to go to Albany, to and back on the same day, to, again, lobby for taxing the rich. And as I put in the chat, it's very clear that this campaign will probably last longer than one day's trip to Albany. So again, I want to encourage retirees. If you can go to Albany, great. If you're near Albany and can meet them there, great. But again, throughout this month and the next, we will be, I'm sure, contacting our state senators and our state assembly people to make sure that this is on their agenda and that they will support it. There was some support early on for this, but we must hold their feet to the fire, and it's an election year, so it'll be easier. The other thing I think we can all do is what Jen Gaburi clearly stated at earlier meeting, is that taxing the rich, the PSC's part of that coalition, is going to be also fiscal, in the sense that we have to contribute so that we are, again, making this a popular event for the public at large, and that requires advertising, and that costs money. So again, if you haven't recently contributed to COPE, and I know Bonnie and Diane, both on the pension committee, have been trying to get this easily done from either your TRS pension or from TIA, and that is very hard to do. So in the meantime, if you can write a check to Vote COPE, please do so, and I'm sure we'll be happy going through February to connect you and link you when we send out messages to the retiree chapter, all the ways that you can help to make sure that we tax the rich, to both cover the budget shortfall in New York City, but also throughout the state and for our CUNY campuses. Thank you.
Okay, thank you very much, Eileen, and thank you all of you who came. And we hope to see you next month, when we're going to have a very interesting meeting about lesser known museums in New York City. So that should be a lot of fun on a less serious topic.
I think Marva has her hand up.
Okay. Marva? Marva, do you want to unmute? Okay, well.
Okay. No, I
there
thought
you go.
the program is on the 3rd, tomorrow at the PSC. She said the 4th.
I thought it was the 4th, but if you go to the website, it will say, I thought I copied that directly from the website, but I could have gotten it wrong. I often do. I'm getting older. So thank you for the correction. Okay, and we'll see you next month. Thank you very much, everyone.